Community Health Worker Training, Cardiovascular Health and Diabetes. Module 5B, High Blood Pressure. Learning outcomes for this mini module: identify the causes and risk factors for high blood pressure, describe strategies for preventing high blood pressure, and explain high blood pressure diagnosis and treatment. Causes and risk factors. What causes high blood pressure? A number of factors can lead to high blood pressure. Sometimes high blood pressure is caused by other medical problems such as kidney disease, but for many people, unhealthy lifestyle habits can lead to high blood pressure. Let's start with some of the controllable risk factors for high blood pressure, since those are things people can do something about. Diet is a primary one, both fat in the diet and salt. So most Americans eat way more salt than their bodies need, and too much salt can make your body hold on to fluids, which can then increase blood pressure. Daily intake of sodium or salt for people without high blood pressure should be no more than 2,300 milligrams a day, or about 1 teaspoon. Daily sodium in the diet for people at high risk of high blood pressure, or people already have it, should be no more than 1,500 milligrams a day, or about 3/4 of a teaspoon. And high-risk people include people 50 or over, African Americans of any age, because they are already at higher risk of having high blood pressure, people who already have high blood pressure, people who have diabetes or kidney disease. Because foods that are not made at home can contain so much sodium, community health workers should work with clients to learn how to read nutrition labels on foods and meals that they buy in a store. And also restaurant meals, and particularly fast food, can be very, very high in sodium. The community health workers can also help patients learn how to follow low sodium eating plans, such as the DASH diet that you'll learn more about in a future module. Unhealthy fat in the diet is also a risk factor for high blood pressure, and that's trans fats or saturated fats. And the reason those are a risk factor is because they can lead to cholesterol building up in the blood, bad cholesterol, and plaque building up on the walls of the arteries, which narrows the arteries and makes them stiffer. And both of those things can lead to higher blood pressure, because the amount of blood going through the artery is the same, but if the artery is narrowed, the pressure is higher. So you want to work with people to reduce both unhealthy fats and salt in their diet. Being overweight or obese raises people's risk of developing high blood pressure. The more you weigh, the more blood your body needs, and this leads to more pressure on the walls of the arteries. Lack of physical activity is also a risk factor, both because people who are not very active tend to become overweight, but also it's a separate risk factor even for people who are a normal weight. An adult should have at least 150 minutes of moderate to vigorous activity a week, and they may need to start small, so starting with about 10 minutes a day and then building up. Children and teens should have at least 60 minutes of physical activity a day. Moderate physical activity means that you can talk to others easily during the activity. If you become too out of breath to talk to others, that level of activity is considered to be vigorous. Aside from exercise, just being sedentary also increases your risk. So just sitting for a long period of time. So if you're sitting for an hour or more, it's really important to get up and walk around for at least 5 minutes every hour. Another risk factor for high blood pressure is alcohol. So drinking alcohol damages the artery walls. So it's important, if you do drink, to drink moderately. For men, that means no more than 2 drinks a day, and for women, no more than 1 drink a day. A drink is equal to 1 ounce of hard liquor, 4 ounces of wine, or 12 ounces of beer. Similarly, smoking or chewing tobacco increases the risk because both things damage the walls of the arteries. If you don't smoke, it's important not to start. And if you do smoke or chew tobacco, stop as soon as you can. Many people need help in quitting because, of course, tobacco is addictive. Nicotine is addictive. And there are some excellent smoking and chewing cessation programs available. Being under too much stress is another risk factor. People who are under stress often find that their blood pressure goes up. Now, our blood pressure always goes up a little bit when we're stressed or even when we're exercising. The problem is if you're stressed so often that your blood pressure is up very frequently. And then finally, not taking prescription medicines as the doctor advises, especially if somebody already has high blood pressure. If they stop taking their medicine or they don't take it as ordered, the blood pressure won't be under control, and that puts them at risk for the side effects and the damage that can come with high blood pressure. Then there's a number of uncontrollable risk factors for high blood pressure. Being African American or Black. African Americans develop high blood pressure more often than whites and at a younger age, and they tend to have more serious levels of high blood pressure. For that reason, African Americans should get their blood pressure checked regularly. Family history. Having a family history of conditions that increase your risk. If your parents or close relatives have high blood pressure, heart disease, or diabetes, you're more likely to develop it yourself. If you have diabetes or kidney disease, both of those things increase your risk of high blood pressure, and so you would want to get your blood pressure checked pretty often if you have either of those illnesses, and you want to try to keep those conditions under control as well. Gender is a little complicated. So men tend to develop high blood pressure younger than women. Being a man age 35 or over raises your risk, or being a woman 55 or over. Men tend to develop high blood pressure most often between age 35 and 55, but after age 65, high blood pressure is more common in women than in men. And then aging in general is a risk. The older someone is, the more likely they are to have developed high blood pressure. What are the warning signs of high blood pressure? So that's a little bit of a trick question, because actually high blood pressure is called the silent killer, because most people don't realize they have it. Usually they have no symptoms. So that's why it's important for everybody to have regular screening for high blood pressure, because even if you're not feeling that you have it, it can be damaging organs all around your body. However, if somebody is having a blood pressure crisis where their blood pressure is extremely high at a given moment, they might have symptoms. So some of those symptoms might be a headache, nausea, sweating or flushing where they kind of turn red, tinnitus, which is like a ringing in your ears, spots in front of your eyes, chest pain or racing heartbeat, or fatigue or swelling in your body. And then that last circle is somebody simply checking their blood pressure and finding it out in that way. How do we help people prevent high blood pressure? Well, think about some of the controllable risk factors that we just talked about, right? So decreasing sodium in the diet and generally having a healthier diet all overall. Again, lots of fresh fruit and vegetables, not too much fat, not in the diet, not too much overly processed foods, getting to a healthy weight, and exercising is super important. Quit smoking if you're a smoker. Limit the amount of alcohol that you drink, and know what your blood pressure numbers are, so that if you do have high blood pressure, you can take your medicine and do the other things that are recommended to help keep it under control. Diagnosis and treatment. So blood pressure is diagnosed by simply, a doctor or other healthcare professional taking somebody's blood pressure, and if they have elevated blood pressure on 2 different readings, at least 4 hours apart, they may be diagnosed with high blood pressure. As a community health worker, if you take someone's blood pressure and find it to be high, please don't tell them that they have high blood pressure. Instead, record their blood pressure and, put a note on it to alert the healthcare providers. If you're working in the community and you're doing a screening, let's say, of somebody's blood pressure, find out if they have a primary care provider that they can go to recheck their blood pressure. if the person does not have a primary healthcare provider, help them find other community resources to go to where they can have it screened by a healthcare professional that could then get them into care if in fact they do find that they do have high blood pressure. High blood pressure is treated both with lifestyle changes in the ways that we just talked about for prevention, and primarily with medication. And sometimes people need just one type of medication, sometimes they need multiple types to get the blood pressure under control. The only way for them to know whether the medicine is working or not is to have their blood pressure checked as follow-up pretty frequently, because remember, this is a silent killer, so they may be taking their medicine and maybe it's not a strong enough dose, or maybe they need to be on another type of medicine. They're not going to know that unless they go to their follow-up visits and the healthcare provider is checking that blood pressure to see how the body is reacting to the treatment that they're on. Now you can identify the causes and risk factors for high blood pressure, describe strategies for preventing high blood pressure, and explain high blood pressure diagnosis and treatment. The next mini module 5C talks about how to check blood pressure and the community health worker's role.